Good evening, and thank you for joining us for tonight's webinar, Adding Laser Services to the Dermatology Practice. First, Dr. Suzanne Sirota-Rozenberg is going to discuss the applications of the LightPod Neo and how she uses it in her daily practice. Then, Lou Frisina will be discussing the implementation and business strategies of adding a laser into your practice. Questions will be taken at the end of the presentation, and if you do have any questions during the presentation, please feel free to ask them at any time by typing them into the question and answer box, and we will try to get to as many of them as possible at the end. So first, I'm going to hand it over to Dr. Rozenberg.
Good evening, everyone, and welcome to our presentation this evening on adding laser services to the dermatology practice. I speak for myself and the company. I have been using this laser for almost 10 years now and have had extensive experience with it, so I'm going to share some of that with you. Our agenda includes patient and practice benefits, laser modalities and chromophores, the unique 650 microsecond laser science, aesthetic and medical laser treatments, and then Lou Frisina will talk to you about why I offer laser services and tips on implementation. Anytime you can ask some questions, and we'll be able to answer it to our best ability. So why do we add laser services to the derm practice? It will enhance cosmetic treatments, anti-aging, improvement of medical skin concerns, and therapy without systemic toxicology. It limits the side effects to treatments by oral medications and topicals, and we find this very effective. How does it help our practice? We have happier patients. It enhances an overall practice image, and the financial enhancement to the practice is significant. Just some basic review. Absorption of the common laser modalities and chromophores. I love this curve. It's basically ingrained in my brain. And this is how I remember, even for board review and things, where lasers fall. And we will be talking about the Nd:YAG 1064 nanometer one. As you see this curve, the melanin curve, the brown curve, is why this laser is so effective and safe in our dark-skinned patients, and even in our light-skinned patients where our targets turn to be hemoglobin, as we see in the red. The red has two peaks that we look at and treat. And then we have our water absorption, which we see in this curve as here. So 1064 describes the nanometer wavelength that we're targeting, and we'll get into that in a little bit more. 1064 has three chromophores, the hemoglobin, the melanin, and water, which we target, and that is why this particular laser is so unique. How do we compare to other lasers? So one thing that is very different about an Nd:YAG is that it penetrates extremely deep into the epidermis and dermis. You're all the way down. That's why this laser requires safety goggles and safety usage, being aware of how to use it, because it can penetrate into as deep into the retina. If you look at your diode or your alexandrite, even your pulse dye and KTP, you'll see that they do not penetrate as deep. Your carbon dioxide and erbium, which target water, remain very high and basically do surface rejuvenation and resurfacing. So what is our 650 microsecond technology? The typical Nd:YAG lasers operate with extended pulse durations, and that can go from 3 to 30 milliseconds. If you remember, laser technology delivers a boost of energy consistent over a period of time, different than our IPL, or intense pulse light, that wax and wane going up and down. This is a technology here whereby the 1064 energy can be delivered with a much shorter pulse duration. Why is that important? One, it makes it very tolerable, but most importantly, the thermal relaxation time of the skin is longer than the 650 microseconds, so that the skin has time to cool itself between each pulse. And this is significant. It allows you time to move through your treatment in a much better way. Why is efficacy high? A pulse duration that is shorter, energy is delivered much faster into targeted tissue structures such as follicles, vessels, anything that we want to treat. The targeted tissue has less time to lose heat through the conduction to the surrounding skin. Therefore, the targeted tissues reach a higher temperature. Why is it gentler and safer? Thermal overstressing of the epidermal melanin is avoided. We're going deeper, so we're not attacking the epidermis as much, thereby reducing the risk of a burn or pigmentary changes. Thermal overstressing of nerve endings in the dermis is also avoided, thereby reducing treatment pain dramatically. So just to review and in summary, the characteristics of this 650 microsecond YAG is versatility. It targets all three chromophores, hemoglobin, melanin, and water. It allows for deep penetration and high power, and rapid tissue heating for higher efficacy and gentler, safer treatments for all skin tones. To this day, this was my first laser and remains a laser I use every single day in practice. So typical uses of the 1064 ND YAG lasers, the longer pulse take care of leg veins and dark skin hair removal. On the shorter microsecond one, we can do leg veins, dark skin hair removal, lighter skin hair removal, because we can increase our strength. Active acne, facial and leg veins, rosacea, skin rejuvenation, tightening, and other medical and aesthetics. And we're going to get into that in a moment. Okay, so let's take our first look at our acne patient. And these are not my pictures. However, I can tell you that I am undergoing treatment with 2 or 3 patients with acne, and they're doing great. So mild to cystic acne, it leads to, the laser treatments lead to thermocoagulation of the sebaceous glands, and also the laser energy superheats the sebum and bulk skin tissue to destroy bacteria. So it's using technique versus as a target. The 650 microsecond technology uniquely allows for pulse stacking on light skin and multiple passes on dark skin. And this is very important for the efficacy on moderate to cystic acne. Laser therapy is safe and gentle even for teens, and it avoids the side effects of antibiotic resistance and other topical, retinoids and systemic therapies. So here's some pictures we can go through. Here you see the patient before. This is 13 months after the 5th treatment. There's another patient with 7 months treatment. So not only is it targeting the active acne that we see, but a lot of the scarring, the redness, all have been helped tremendously. Here's another patient with folliculitis, acne as well, and dark skin treatment. After 1 treatment, you can see also very little hyperpigmentation seen here. Here's a patient about a type 3 before treatment. Look at the response of your acne scarring and shutdown of an active process. Talking about rosacea, I love it for rosacea. I use it all the time. Again, it has high hemoglobin absorption. The 1064 nanometer is a powerful and deep penetrating modality. So in addition to diffused redness, small vessels and broken capillaries can be cleared. You're able to use a high fluence and shut these patients down. It's not permanent because I tell all my patients that we get a permanent result, but we need maintenance. Our faces are dynamic, and all patients need to understand that. The 650 microsecond allows for safe delivery of multiple passes across the facial skin without concern of pain or complications. So here you can see this patient after the treatment. I know the lighting is a little bit different, but after a second treatment, you see significant decrease in the redness, the telangiectasias, the overall edema of the face that we see in rosacea. Facial veins, this is still my staple and favorite laser to use. Again, because of the ability to have a high hemoglobin absorption, you can target these vessels on the cheek. It penetrates and it significantly collapses the vessel walls. The 650 microsecond allows for safe and gentle use of very high fluences up to 255 joules per centimeter squared on facial skin. Now, if you were to go, we say skin types 1 to 3. I do have a few dark skin patients that have wanted it. I do warn them about crusting and tell them, you know, you don't go as high with the fluence. And here you can see after the second treatment, a nice result. Again, moving on to leg veins. So, you know, leg veins, we know that the sclerotherapy remains the first-line modality. But for those patients that don't like sclerotherapy, they don't like needles, they don't like, they have urticaria, you're concerned about allergic reactions or darkening, this 1064 laser allows you to, again, target the high hemoglobin absorption. It's powerful and deep penetrating. So I showed you that depth curve. You can see how it goes deep and can shut down these vessels. Again, the energy collapses the vessel wall. You can go up to as high as 318 joules per centimeter squared. And here's after the second treatment. I did this yesterday. I have a significant sclerotherapy patient, but I have a patient with chronic urticaria and itch. So she's not a sclerotherapy candidate, and I used this laser yesterday. She did fantastic. I will tell you that after you hit the veins, they almost feel like they urticate a little bit, and then it goes down. It's a wonderful modality. Another one of my favorite treatments is angiomas. Patients hate these. So generally, I'll tell you, I charge about $150 to hit about 10 to 15 of them. I usually end up doing about 20, and I target them. The 650 microsecond laser allows for the safe use at high influences, and again, it helps, they shut down, they turn a deep purple, and then reabsorb by the body. Fantastic results with this. It also is effective in treating infantile hemangiomas and port wine stains. Here you can see after one treatment the difference in angiomas. I love this. My patients love this. And here we have a hemangioma after 8 sessions over 12 months. I think that's a pretty significant treatment. Usually you only see this with a PDL, but you can see this with the LightPod Neo. Talking about laser tissue interaction, again, scar revision. I use this all the time for scar revision. The redness in the scars is the target very often, and it's to reduce the color and intensity. What you see also, if you were to look with your dermatoscope or under, you'll see fine vessels. So when I do this treatment, I target that as well. And I'm hitting those vessels, it brings down the red significantly, as well as collagen stimulation. We see very nice results. And here you can see, basically, you'll see over time, this is after one treatment, the redness is down. That's a pretty good result. I just used this today. Yesterday I injected a woman's lips, and this is exactly the picture that she came in today, except for it was on the left side of her upper lip. So I now use this as a modality when I'm doing my injectables and they get bruised. By doing a few treatments, within a day or two, you can significantly cut down on their bruising. The laser energy is absorbed into the blood, it breaks down, and the body reabsorbs the material. Post-filler bruising, that's a pretty nice result 2 days after one treatment. Now, you might say that, you know, the patient's going to reabsorb anyway. Well, they are, but this helps speed it up, and this allows that if this result happened on your left, then, and they had an event or they had something to go to, this will help you in shutting this down and making your patient much happier. So for skin rejuvenation and tightening, the 1064 nanometer laser energy superheats the papillary dermis, stimulating collagenesis, while also breaking down reds and browns in the skin. You can do multiple passes with this laser for maximum improvement in tone, texture, and tightening in a gentle, pleasant procedure. So I have a few patients that I've been doing laser hair removal on with their maintenance treatments, and their skin has had the benefit of the tightening, which, you know, initially when I bought it and I started it, it wasn't something that I was looking at, and then we found that it helps, and they have significant tightening with it. So the patient that doesn't want to undergo surgery and doesn't want to go anything drastic, this is a nice alternative with multiple treatments. It avoids also the pain and potential fat atrophy that you could see with radiofrequency and ultrasound modalities. So here you can see some nice results after a second treatment. Talking about hair removal, the 650 microsecond technology compensates for the limited melanin attraction of 1064 laser energy. It's safe on all skin types and on tan skin all year long. It's gentle, it's less painful than other devices, and you don't need numbing or skin cooling. Published studies shows efficacy is similar to modalities such as the diode and alexandrite lasers, which you cannot use in dark skin patients. And you can really see some very nice results with this. And one of the things I often tell my patients is that the skin tightening comes along with it, so their lip lines tend to do much better. This is 9 months after a 5th treatment. I remind you that the upper lip is extremely hormonally sensitive. We are talking about, as you see in this slide, permanent hair reduction. The difference is you are not seeing permanent hair removal. We can't control hormones, and as the body changes, so can the hair production. So be very careful. That distinguishes you from the salon that is saying permanent hair removal because they don't know what they're doing. I have multiple patients like this. There's pseudofolliculitis barbae. PSB is extremely irritating and cosmetically bothersome to most male patients. You see post-inflammatory hyperpigmentation in the surrounding area. I even have women with this. We're able, with the 650 microsecond technology, we're able to create follicle destruction without pigmentary risk on the tanned or dark skin types. The laser destroys the underlying curled up hair, removing the lesion and the inflammation. Thus, the PIH also tends to resolve. I have seen this repeatedly. My patients that come back for their maintenance look great. They're off most medications, and I will tell you that on men, you must tell them that the hair will not grow back evenly in this area, or that, you know, there's a good chance that most of it will be gone. You must make that aware, especially when they sign their consent. The hair in this squared area is not going to grow back the same as everywhere else. So they must be aware of this. You could see significant decrease in inflammation in this patient's face. Talking about lentigos, here the technology compensates for the limited melanin attraction of the 1064 laser energy. So although we tell you it's melanin safe and we're using it with lighter pigmented lesions are more difficult to treat than darker ones, and although it's sensitive, when you put enough energy in, it will help to remove these lesions. And you can see there, you can still see faintly where it was, but this will just get better and better. Again, it's very important to remind your patients to use sunblock and not get tan because then it will return. Melasma. The melasma has two components. It has superficial and deep. So this is a perfect laser that works to treat it. It penetrates deeply into the affected area, helping to break up the deeper melanin. You can do multiple passes, and even on the darker skin, like you see here, it works great. Melasma that has a vascular component underneath, when you shut down the vessels, it helps it as well. A dynamite way to do is to treat this in combination with either a glycolic peel or even with an IPL, sometimes you can do that to get them more superficial, so you can combine treatments with this. I love it. It's great. And here you can see even after one treatment combined with a glycolic peel. This is significant. So your glycolic peel will get your more superficial pigment, and your laser will get your deeper pigment. Onychomycosis. The energy penetrates through the nail into the nail bed and nail matrix. The pigment in the fungus may attract some energy. Also, bulk heating of the nail bed can superheat the fungus. And you're going to treat the entire nail, like I'm showing you, and all the way around the nail bed. The side effects of systemic therapies can be avoided with laser treatment. I do use a Zimmer or ice packs because I'm using high intense fluents here. And I find that the patients tolerate it really well, either with ice packs or blowing a cool Zimmer. And here you can see some nice, a really nice response 10 months after a treatment. One thing I will tell you is sometimes the nail itself remains a little dystrophic looking, but if you were to culture it, most of the time there is no fungus left. For wart treatments, you can absolutely, I use it for my wart treatments all the time. The high fluence targets and breaks down the vasculature feeding the wart, the capillaries. I think it's a good idea always to debride the wart before treatment. This does hurt the same like the nail, so I would tell you to use ice on your patients or blow the Zimmer. Because these are viral particles, either wear a mask or use a vacuum, a vacuum to suck away the debris so that you're not inhaling it as the instructor. And here you can see a nice result after the 4th treatment. Warts, freezing, over-the-counter wart remover, and duct tape all failed on this patient. You have to tell your patients this is not one and done. This requires multiple treatments because the wart virus itself is living up there, and you have most of those capillaries that you need to shut down. It's a pretty well-tolerated procedure. For psoriasis, the laser energy superheats the hyperactive vasculature beneath the affected tissue. So, again, you are now shutting down the supply to the psoriatic plaque. Clearance of the microvasculature helps to clear up the condition. Again, the patients who don't want to be on systemic therapies, don't want to have constant treatment with creams, this is a nice benefit to do that as well. And this is after the 6th treatment. So you can do these 2 or 3 treatments a week. This is my patient. This is one of my most favorite ways of using the 1064 650 microsecond laser for wound healing. It heats water in the papillary dermis to stimulate collagen growth, regrowth, and helps with wound closure. It'll bulk heat the skin tissue to destroy the superficial bacteria. It is tolerable while delivering high power and efficacy. So this was an injury to this patient in the center. The 6 months prior to seeing me, she was using honey. Her physician was from England. Honey is a very popular treatment, even here in the United States now, but we couldn't get her closed. If you look up here, you'll see vascular, varices, varicose veins, and so she needed multiple ways to treat this. She wasn't going anywhere. After the 7th treatment, you can see we've significantly closed this down. The LightPod Neo is FDA cleared for debridement of decubitus ulcers. I use this all the time in skin tears. I use it in wound healing. I use it post-procedure. If a wound dehisces, I use it. I think it's a phenomenal treatment. It also is billable to the insurance companies because it's wound care.
Thank you, Dr. Rosenberg. And now we will transition over to Lou Frisina, discussing the implementation and business strategies of adding a laser into your practice.
Hello, my name is Lou Frisina, and I wanted to thank Aerolase Corporation for inviting me to this important webinar. Tonight I'm going to be talking about why offer laser services in your medical practice, aesthetic medical practice, or med spa, and at least tips on implementing any laser successfully based upon my own 15 years of experience of visiting over 2,000 aesthetic medical practices around the world. So why offer laser services? There's a lot of reasons for offering laser services, and there's not very specific data out there, but based upon best practices in my own personal database of medical aesthetic practices, about 20% of all revenue is derived from laser services, representing about 15% of all patients. The average service price is around $1,000 per treatment, which makes it also much more profitable. It's important in best practices or in any practices because of the recent advancements in the use of lasers for acne, for vascular applications, for skin tightening, and of course for mainstay laser hair removal. And more recently, and in conjunction with some of the other companies, non-laser companies out there, there's been clearly more advanced combination therapy procedures employing both lasers and injectables or chemical peels or even the most recent thread lifts to basically get an optimum rejuvenating effect for individual patients based upon the individual needs of those patients. The other reason why I'm offering laser services is it really advances you, kind of differentiates you from all of the other providers out there. Not everybody is able to make that investment. Doesn't matter whether it's a financed investment or an outright purchase investment. It definitely separates and differentiates you as a more advanced practice, one with, quite frankly, more advanced therapies, and it's a great opportunity for marketing differentiation and market differentiation at this point in time. The other and last thing about why offering laser services, most of us have expensive providers, doesn't matter whether they're physicians or PAs or ARNPs, and in all honesty, a higher profit margin in best aesthetic practices is achieved when these types of higher cost providers are actually doing these higher priced procedures in the practice. So what laser services are we talking about? What applications? I think basically there are many applications, but there are primarily 5 that I look at. The first one, and again, because of some of the most recent advancements in clinical studies performed by key opinion leaders like Dr. Michael Gold from Nashville, et cetera, is the area of acne. And it basically solves, in combination with some of the systemics out there, we can reach in a practice systemic therapies combined with laser technologies that can not only clear severe acne, but actually advance the timing and efficaciousness of some of the systemic therapies out there, whether they're minocyclines or others. The second area is the whole area of vascular. This basically is involving things like rosacea, something that I personally suffer from, telangiectasia, angiomas, filler bruises, and other applications. And again, here, a lot of clinical-based evidence has been set out by key opinion leaders like Dr. David Goldberg from New Jersey and New York. Third area, which has been a continued development in non-invasive procedures in both aesthetic medical practices and in med spas, is of course the area of skin tightening. This can involve not only a higher level provider, but it can actually, quite frankly, be leveraged to use skin tightening applications and treatments for PAs and ARNPs, as well as in certain specific states, medical licensed estheticians. Laser here is a mainstay, and depending upon the numbers that you see, it can represent anywhere from 10 to over 35% of the actual cosmetic revenue that's produced by the providers in an aesthetic medical practice or med spa. The benefit of laser here is not only is it a lower entry, a lower barrier to entry cosmetic treatment to draw patients in, and, you know, focus on specific areas, whether it's bikini or underarm or legs or the back and so forth, but also be able to do this on all skin types since it's a broad and diverse treatment application. And even in states like the one in which I live myself in Florida, to be able to do tan skin would also be a major benefit. And then the last application of what laser service use, of course, is the area of ablative treatments, which are surgical-like resurfacing results and done as a non-surgeon. So let's talk about implementation tips based upon the experience that I've achieved over the last 15 years. I think the first one, and my own recommendation to you, is you need to buy a laser based on the benefits, and the benefits that you are specifically looking for with that particular system and those particular treatments and applications specific to your practice and so forth. You need to figure out what the right laser procedure is and the applications that you are specifically intending to do. And I've given you 5 groups of various laser service procedures, but depending upon where you are, what you already have, what the market opportunity is and what the target audience is in your specific market area, it may require or demand a certain type of laser and a certain type of applications from that laser. So please don't compromise here. Be very, very specific and very, very self-righteous in terms of the benefits, in terms of what you're buying for and why you want to benefit. And so you purchase them on benefits, and that's what best aesthetic practices do, and those benefits accrue to either providers and or to the overall practice themselves. When you're looking at benefits, you should be looking at, in your specific practice, what's the return on investment that I should be able to expect from this particular instrument? How long is it going to take me to basically write it off, and how many patients do I actually need to treat, and the pricing that I need to be able to be servicing this at in order to be able to write this system off. Again, based upon the cost of the acquisition of the investment, will determine how long and how many patients. But obviously, post-recession, there's been an increasing demand for lower-priced systems, which obviously would in turn require a lower number of patients and a lower length of time in order for you to pay or write off that system. The other benefit that clearly is important is service. This acronym, mean time between failure, MTBF, has been used in the clinical world for many, many years, starting in the hospitals. And you need to buy on benefits here because, you know, depending upon the mean time between failure of that system, you want to have that system up as much as you possibly can, you know, at any point in time during the day or over the weekend or during the night. And it's critical for you to assess and to demand from the service company or the laser company exactly what their MTBF rate is in the current systems. The next thing on buying benefits is the acquisition cost. You need to look specifically in your own financing situation, whether you can afford to purchase it outright, whether it's an outright, whether it's something you go to your bank and finance, or whether you to look at various lease options, either directly from the laser company itself. Sometimes they have a third-party financing opportunity, or other lease companies that are available at this point in time. And then lastly is the consumable cost. This is a hidden factor of cost in a treatment. You need to look at what the actual cost is for any consumable supplies, whether it's tubing or tips or whatever, on a per treatment, on a per patient cost basis, so that you can overall assess what the return on investment and benefits would be to your practice from a bottom line and profitability standpoint. Now, on this one tip of buying benefits, and specific to the Aerolase LightPod Neo, which quite frankly is one of the more disruptive technologies out there and one of my favorite overall laser systems. Let's just go through the points that I made and then talk about how the LightPod Neo might apply here. So I said figure out the right laser procedures and applications for you. The nice thing about the LightPod Neo is it has very, very many multiple treatment applications, which is something that I like. Again, not unless you're a much more advanced practice with several different lasers that you use specifically by treatment or application, it's best to have a workforce out there that can treat multiple applications, and specifically the ones that are hot at this point in time, which are, again, severe acne, facial veins and rosacea, skin tightening and rejuvenation, laser hair removal, and these are the core four applications that you would get the most diverse marketing and attraction to bringing in patients. The next factor that I said is that wow factor. What are the clinical benefits and so forth that are being brought to the party by this particular system? Well, interesting enough, and based upon my own diligence and the clinical data to date that Aerolase has put together over the many years, Neo has clearly great acne clinical efficacy, and through Michael Gold's work, and clearly great vascular efficacy, again, through some of the work that Dr. David Goldberg has done. In the area of dark and tan skin, again, there is additional wow factor clinical benefits, and have heard many of the speeches from Dr. Cheryl Burgess, who has used it, you know, in many applications in the Fitzpatrick skin types in the 4 and 5 range area. So Neo really does have that broad application and can span across all of the key wow factor clinical applications that are important at this point in time. Purchasing on benefits to providers and practice, again, the nice thing about Neo is it has a relative compared to other laser systems out there, it has a much lower relative price point. There is financing available out there, but the benefit of it to both providers and practices is that Aerolase actually has documented and validated a California practice that alone in one system, in one practice, has generated on that Neo over $1.5 million across many indications, including laser hair removal. So there's definitely valid, vetted out experience out there that this particular system, given its wide applications and the wow factors that it presents, can generate a lot of revenue for the practice and of course to the bottom line. And then overall, that very important question: how long is it going to take me to write the system off? You know, based upon the relatively lower price point of the Neo system compared to other lasers that are much more expensive, and quite frankly, many of which have more limited applications, the best estimate that I have at this point in time, and in consideration and consult with the company, is that it requires about 60 patients. If you did 5 patients per week, 1 a day and so forth, quite frankly, over a period of less than 3 months, you will have written off that system, and then in the future, everything would be straight to the bottom line. And at this point in time, as you'll see from the next slide, not only is the mean time between failure extremely low because it's an air-cooled system, it's disruptive technology, it doesn't have an HVAC water cooling system, which has a tendency and preponderance of breaking down, so it has a low to no service ratio. The acquisition outright financing of this, as I said, is extremely low. The cost of ownership is low, and there's even startup financing available from a third party of Aerolase that they're related to, that can basically, for a relatively small amount per month, get you 3 or 4 patients and be able to justify and write off that system on a month-to-month basis. And the consumable costs, which again, as I said, is important, they have really at this point in time no per patient or no per treatment consumables, which is rare. Okay, let's go on to implementation tip number 2, employ best providers. This is a service business, and the best aesthetic practices, quite frankly, have the best providers conducting these best laser treatments across these various treatment applications. And the bottom line is, if you have the opportunity and you are a practitioner or provider, the highest gross profit opportunity for the practice and for you is if you actually do the laser yourself. If there are other procedures, aesthetic procedures that you're doing right now that could be leveraged down to a mid-level or even to a medical esthetician and give you the opportunity of conducting these laser treatments yourself, it's just going to create more of a higher gross profit margin opportunity. And you would see, if you went to Dr. David Goldberg's or Dr. Roy Geronimus's or some of these other big aesthetic, well-known and successful practices and big laser folks in the world, you would find that they're doing most, if not all, of these laser treatments themselves, where it makes actually a sense to do that. Additionally, employing the best providers means hiring. And whether they're laser techs or other mid-level providers, as an example, there are clearly companies like, most recently, Indeed.com, ZipRecruiter, and Craigslist, which at least the practices that I've been involved with have been very successful in recruiting these best providers to conduct these laser treatments. PAs and ARNPs, in my own experience, and based upon best aesthetic practice pro forma income statements, the best provider to do most, if not all, of these laser aesthetic procedures are PAs and ARNPs versus physicians who may be doing even more higher level, quasi-surgical or, less, more surgical type of procedures. And in those particular cases, a higher gross profit margin can be attained by basically recruiting PAs and ARNPs to perform these laser treatments, and generally provide on average anywhere between a 60 and a 74%, in my own experience, gross profit margin after consumable use and labor employed. Lastly, medical estheticians are an increasingly fundamental part of any aesthetic medical practice. And in many cases, they are the highest gross profit generators, even more so than the physicians. A little secret among best aesthetic practices. It's best to hire, and there are many out there that are experienced or have been serious trained or are willing to be seriously trained on a state-by-state basis and according to their eligibility to be able to conduct some, if not all, of these treatment applications associated with the NEO or any of these other laser systems. The third implementation tip, which again is about execution here, is establish your protocols. Establish what the purpose of that particular treatment and procedure is, who the client target is, what the treatment plan associated with that particular client and condition is, and what are the parameters specifically on that system that you need to utilize in order to optimize the clinical efficacy and benefit of that particular laser procedure. So there are not only detailed pre-screening protocols that have been developed by best aesthetic practices, but you also need to consider and detail out for your own practices not only the clinical protocol of conducting the actual treatment, but also the pre and the post-op, especially when you get into more ablative laser resurfacing, where there's going to be some level of downtime and some more additional requirements for wound healing. Those post-op clinical protocols are critical for that particular client or patient to have the type of experience that they need to have and so forth. Video protocols have been used if possible, and any tips locally that you've acquired in your own practice should be built into those protocols. And once all of those protocols have been developed, the most important thing to ensure adequate and timely and complete and accurate implementation is to have that provider read those protocols if they weren't already vested in developing them, get trained on those protocols, and then actually physically, from a signature standpoint, sign off that so that all of us know that they have understood what those protocols are. They feel that they're properly trained on and agree that by their signature representing that they're capable and quote unquote certified without being legally certified, to be able to conduct that treatment and procedure. So very, very important, and I can't overstress the importance of detailing protocols. On the same accord, detailing out the actual schedule and the templating is a very, very important thing to be able for your aesthetic practice, like best aesthetic practices, to be able to manage on an efficient and an effective basis the customer flow and efficiency in your practice. So realistically, and I use the word realistically because I've seen protocols that clearly no one could get done with before 30 minutes, putting in a 20-minute slot. So realistically, put together adequate treatment times from start to finish, and that requires, any of the prep in that treatment room, or if you can put them offline in another room and then bring them into the treatment room if you've got a very busy practice, and also allow for that kind of post-op or post-treatment conditioning or any instructions that either the nurse or your medical assistant or yourself needs to provide back to that patient before they exit the room. Leave time in the treatment template also for client recovery and exit. There are, I think, too many situations that I've personally experienced where somebody has actually gone through a fairly intense laser resurfacing. It's a busy practice. They try to move them out of there, and they may be bleeding. They may not have been adequately, facially taken care of. And please, for the sake and safety of the patient, and also to round out and complete that wonderful patient experience after you've invested this time and money into this laser, to allow for adequate client recovery and exit. In regard to templating treatments, and this is a big question in terms of optimizing flow and efficiency, best aesthetic practices use a number of different templating business models and so forth. Sometimes they'll template out for the whole day. So on Wednesday of this week, we're going to be doing all of the laser hair removal. On Thursday, we're blocked out 4 treatment clients to do laser resurfacing. On next Tuesday, for at least the morning, we're going to be doing skin tightening in 30-minute intervals or 45-minute intervals for a various amount of patients. So I would look at either days or big blocks of time that gives the provider an opportunity to get into their zone and stay into their zone, for the system to be kept on and being used on a continuous basis, which is always better for the system, I believe. And it ultimately results in, when you look at this templating and blocking, whether it's by days or big block of time, just overall higher productivity and much more efficient flow and efficiency in the practice. You can also look at templating these lasers based on the provider's profitability or the treatment profitability. And again, overall, you need to assess how the templating is going to impact whether you're a medical derm office or a medical spa or a combined surgical general aesthetic medical office and so forth. Really have to assess where the optimum place without interference and without drama and interruption to place these various laser treatments into the client flow and efficiency. It's become a big, big issue. It's something that I'm increasingly spending my time on with the clinical staff and with the management of some of the various best aesthetic practices that I've worked with. Finally, on number 5, implementation is about marketing. And I can't stress, after you've made that investment in that system, in many cases people feel like, they've already spent the money on the system, and they forget that in order to be able to do this on a full basis, full implementation, and really fully experience both the clinical as well as the business benefits to the practice and to yourself, is you've got to allow for a certain level of budget to conduct what I call full marketing. Conducting full marketing means making sure that you've made all of the internal marketing things put in place, some of which does not cost you any money, but it is time and sweat equity and so forth, regarding banners, regarding treatment, what treatment rooms you're going to be having, various information, some external marketing opportunities, whether you're doing community outreach to other non-competing physicians or fitness centers or other GPs or FPs out there that aren't in the aesthetic business. That's an important thing to do. I cannot underestimate the importance of digital marketing, both social media and website and SEO. Over 72% at this point in time of all referrals are coming off of digital marketing, whether it's Facebook or Twitter or Instagram or Snapchat or LinkedIn, or off of your website, and the navigability of your overall website on a desktop, and more specifically on what they call a responsive device, which is your mobile iPhones and Samsungs and so forth. You have to make sure that you've made the proper investment to fully realize the benefits of your investment. There are educational seminars of which Best Aesthetic Practices conduct on a monthly basis, and they're published on their website, and they use constant contact or demand force or other ways of being able to reach these prospective clients and patients and get them signed up for, cross-referral and upselling and so forth. And then all of the e-blasts and all of the e-newsletter opportunities that basically, and even public relations, sending out a PR release that you've actually brought in a state-of-the-art laser system that's going to be targeted towards these applications, and look forward for you to call in, a call to action on a press release. Look forward to you calling in to basically line up your appointment and so forth. So overall, and apologize for rushing through a little of these slides. I could spend many more hours discussing each of these slides and opportunity, but hopefully this has given you a general overview on why laser services, what laser services are offered, a comparison, at least with the LightPod Neo, in terms of why this is, in my mind, an ideal system for the majority of practices out there, and I think their financial results and business results this year are basically validating that opportunity out there. Buy-on benefits, make sure they're the right benefits for you and your specific practice. You need to weed through what the salespeople are saying. They talk in generalities. They don't talk in specifics, and they sometimes don't spend enough time in your practice to really understand what the true opportunity is for that particular laser or another laser. Hire the best providers and make sure they're trained like heck. And then make sure from a detailing standpoint, from an operational implementation standpoint, that you detail out the protocols from pre-op to the actual conduct of the treatment to post-op wound healing, to make sure that you're fully rounded out that optimum clinical benefit to the particular client. And then schedule laser providers and procedures by templating from a time standpoint, whether it's days or blocks of time, again, to optimize the overall client flow and efficiency. So I'd like to thank you very much for spending the time this evening. I know that it's late for all of us, and I hope that some of these tips that I've learned from many of the best aesthetic practices out there might have an application or two for you. And in consideration, I thank Aerolase Corporation for inviting me to the site, and wish you a wonderful evening. Thank you.
Again, for those out in the audience, if you do have questions, please type it in. I'll start with the first question. It is in respect to treating the tear trowel, which I assume they're talking about either raccoon eyes or a dermal.
I can answer.
Okay.
So, it's a great modality for skin tightening. You have to remember that tear troughs sit very close to the eye socket. So, in combination, it's great. It's not something that I would use exclusively there. However, you have to make sure when you're angling the handpiece, you have to angle it down and away from the eye, or using internal shields. Remember, this is a penetrating laser. I use it all around the eyes. You can use it by the crow's, and you can help to use it on telangiectasias. I use it all the time on the inner part of the bridge of the nose by the tear trough. But again, I'm very sensitive to the placement of the shields and goggles.
Yep, and with that being said, we do have a number of customers that do use it in conjunction with dermal fillers as well to round it out.
Yes, they do. It would ideally be used with that.
Okay, and going back to Dr. Rosenberg's presentation, so during the presentation you had said that the Neo was one of your favorite lasers for facial veins and redness. Could you just elaborate on that a little more?
Sure. So it has a lot of different settings, and it's a 2-millimeter spot size, and you can vary the fluence significantly. So alar vessels are the most difficult. They're under a lot of pressure to close down, and with a 2-millimeter spot, you can really hone in and trace the vessels. So it works dynamite. I use it all the time in those areas, also on the chin, on the cheeks. Another process I do is called the genesis, where you lower the fluence and you do a circular pattern over the cheeks, and that overall helps to bring down the redness of the cheeks and the nose. I just find it so easy. I flip it on and so easy to use. By the way, one of the things, just to let everyone know we didn't mention is that this laser is very easy to travel with. So if you have multiple office sites, you just pack it up and take it with you. And I've done that myself in the past.
Okay, excellent. All right, so this is kind of a question for both of you. A question about building the practice out, adding lasers. Would you add lasers, implement fillers, Botox to round out your practice all at once?
Louis, you want to take that and then I'll add in?
Sure, I'll take that. I think at this point in time, if you're starting up a practice, the market is actually reasonably mature at this point in time, at least a good, 15 years, and numbers that are in the 40 or 50,000 in terms of people who are actually practicing aesthetic medicine. So from a competitive standpoint and breadth of services, it's probably, I think you have to pick your poison for sure. I think you should try to specialize in something that makes you unique and differentiates you from other practices out there. But I think from a one-stop shopping standpoint, I think you do have to have, aesthetic services and Botox and fillers and laser services.
So I agree with you. I would also, though, caution everybody, you do a stepwise approach. You can't become an expert overnight in everything. This laser for me was actually my first purchase before I did my fillers and my Botox and such as that, and then it just kind of fell in. Once you decide to go down the route of an aesthetic practice, you've got to start. And, this is a great starting point. And like I said in the presentation, I've used this for 10 years consistently every single day. But I do mix in fillers and Botox and cool sculpting, different things, because as my patients get to know I'm an aesthetic practice, they come in and they question. It kind of leads you down the road of, okay, what else do you have to offer? And so it's a great vantage point for that. When you become very limited and only do one or two things, it does shut the door and tends to push patients out. So you do need to educate yourself and become expertise in numerous modalities.
Okay. All right, so with laser, we talk a lot about cash-based treatments, but you had spoken, Dr. Rozenberg, about reimbursable treatments. Do you recommend people doing both, one or the other? I mean, what's your preference?
Oh, I absolutely, when I treat warts, some of them are kids coming in or people coming in, and that's a reimbursable service. So I more or less put that in under the same code as 17110, which is, what I use for either my liquid nitrogen or curettage or podophyllin or something like that. So I absolutely mix this in. I don't charge extra for it. I do charge for onychomycosis on this because it's not a covered service if I do it. And I said on angiomas I don't charge. That. Those are all cosmetic procedures. But warts can be mixed in, and for sure on wound care. Usually for wound care, the patient comes in, and that first visit is an initial consultation. The wound care procedure, there is a code for wound care, and it gives it by the size. It's something like 97657, I think, is the code. And that is covered by insurance, and it can be covered if you have to see a patient 2-3 times a week. The first visit is the one with the 99213 or 99212 for your E&M, and then after that, it's just wound care code. And I usually think it reimburses about $35 a treatment. It might not sound like a lot, but it actually, you know, because I'm a medical and cosmetic dermatologist, this does add a great, unique service to my practice. My patients love it.
Okay, great. And along with those lines, you know, for you, Dr. Rozenberg, would you ever consider going strictly cash-based? Or would you recommend that model to anyone? And Lou, you can chime in.
I would tell anybody to use that model. But let's say you're not a cash-based practice, then wound care kind of doesn't fall into it, or, you know, if you're treating medical conditions. I think if you're treating psoriasis, there's a code for that, 96920 or 2122. So there are medical codes. You have to be careful using a, you know, fee-for-service unless you're just a non-participating physician in anything, and then you can charge what you want.
Okay.
But I like the mixture of it, because I see kids like, let's take an acne patient. You know, you can kind of mix both. Remember, kids, parents don't want to pay as much, especially with these high deductible plans that they have. They don't want to pay much for laser services. So it's a kind of balance. So I'll see a patient with a medical visit, and they might need extractions and injections, but I might do the laser first and charge them for the laser. But I also charge for a medical visit when I'm doing other stuff like extractions or injections. So depending on your practice, if you're strictly a cosmetic practice, that's one thing. But if you're a medical derm and cosmetic practice and surgical, there's ways to mix it in as a very nice model.
Okay, excellent, excellent. And I just want to extend that out to Lou. You know, obviously, Dr. Rozenberg, you're a very established practice. With people that are entering into the cosmetic market, you know, do you think that's a wise decision to strictly go cash-based?
That also brings in a parent. It brings in a sibling. It brings in an aunt, an uncle. It brings in different people. So what might start off sometimes as a medical visit can very much end up as a cosmetic visit. And if you have ways to offer different things, it kind of brings it all around. And I think you do have to protect yourself, especially knowing your area, in mixing the two types of practices.
Excellent point. And obviously we want, you know, to take all views and sides of everything, and I think you brought up an excellent point on that right there.
There's a question that says, do you provide some fee parameters for suggested fees and consultations? I think, Sean, you get, you know, we can't, the fees are really what's marketable in the area, but there are suggestions, and there's everybody over at Aerolase that helps, or even the person training, you know, you always helps and gives suggestions. I know when I go and do the training, I always give suggestions and help with all of that.
Yeah, absolutely correct, and it's always going to be a regional thing and what you want to, you know, provide for yourself as well. But guidance is always there for sure. So, okay, if we don't have any, let me see, no more questions coming in. But all right, so for the sake of time, it is getting a little late for you, everyone. We have been on for a while, so. If we did not get to your questions, we will follow up afterwards, but I would just like to thank everyone for joining us tonight. Again, you can always feel free to reach out to us for any other questions, but also we'd just like to thank Dr. Rozenberg and Lou for their time and expertise on all this, and thank you very much, guys.